You know that 70% of the US population has some form of gingivitis or gum disease. Hi, I'm Reiaz Ali. I'm a periodontist. I am at Maryland Periodontics and Dental Implants. I wanted to talk to you today about gum disease. Gum disease comes in different forms. Gum disease can start off with what we call gingivitis, which is just bleeding of the gums and some irritation and some soreness, but it can also go all the way to the point where you're losing bone around your teeth. And when you're losing bone around your teeth, you're eventually going to lose your teeth. I wanted to use a model to demonstrate that. I'm going to use this model. I call it my handy dandy model because a lot of patients love it. But when you look at this model, you can see on this side we have healthy gums. On this side we have inflamed gums, sore gums, gum disease, periodontitis. Now, when you look at where the gums meet the teeth, there's a space between your teeth and your gums. On the healthy side, that space is really small. It's usually about 2 to 3 millimeters. That space will accumulate food debris every time you eat. Food debris attracts bacteria. Bacteria will cause your gums to become inflamed. So the longer that food stays in there, the longer the bacteria has a chance to cause a problem. When the bacteria sits in your gums for too long, it causes your gums to break down, and the breakdown causes that space to get bigger. The bigger the space, guess what? You're going to start accumulating more food and more bacteria. Eventually, what's going to happen is the bacteria is going to get to the bone. So I use this side of the model to show you have gums and you have bone. See that nice bone line? If the bacteria gets down to the bone, we're going to start losing bone, and we're going to see a random loss of bone around your teeth. I'm going to turn it now to the bad side. The bad side, if you look at it, see this line right here? That's your bone line. It's now raggedy, jaggedy. That's what I call it. Very uneven. So what we're left with is a very big space between your teeth and your gums, which allows more food to pack in uncontrollably with the bacteria staying in there. And that's what we call periodontitis, and that's how we start losing our teeth. It's really important to understand that the bacteria around your gums is not just staying in your gums. It's actually going through in your system. And what we found is that gum disease is related to a number of systemic health problems. It includes diabetes, heart problems, Alzheimer's disease, even some cancers. It's really important that you get checked for all of this because you want to try to save your teeth and stay healthy, and you want to keep your beautiful smile.